Hi, I'm Dr. Moshe Roth. You want your child to succeed in school, and they deserve to be in the best position to succeed. And that's why it's so important to schedule your child for a comprehensive eye exam by a developmental optometrist. If there's a vision problem that's preventing your child from succeeding in school, we can help. Well, about 80% of what a child learns in class is through their visual system. We all react to the world around us through our senses. Children learn about the world through their senses. Vision is the number one sense that we bring information into our brain. Children who can't physically focus become frustrated when they try to read. If they can't physically focus, they can't mentally focus. If a child has headaches when doing schoolwork, like doing math homework, for example, that's a sign that there's a vision problem. A child then learns to avoid those things that give them the headaches. If your child has trouble concentrating or acts out in class, that can mean that they have a vision problem. These problems at near are often not identified by a pediatrician or a school nurse because those professionals typically look at how a child sees off at a distance, as with the standard eye chart. Pediatric ophthalmologists are eye surgeons that direct their examination to eye health issues like tumors or glaucoma or congenital cataracts. But vision and learning occurs in the brain, not in the eye. Each eye can be normal and healthy, but if the two eyes aren't working together as a team, then that leads to reading and learning problems. That's a totally different problem than an eye health problem that an eye surgeon is looking for. Vision occurs in the brain, not in the eye. It's the brain that controls how visual information gets into the brain and then is processed. It's the brain that controls how the two eyes track together when reading a line of print, how the eyes line up together, and how they physically focus. And that's why an examination by a pediatric ophthalmologist usually does not identify these types of problems. The standard eye chart that a child reads at distance doesn't tell us how they function at near. And it's at near that we do most of our reading and learning. When someone has a vision problem that eyeglasses don't solve, it can make it challenging to read or do written work or focus or catch a ball. And it's made even worse when a child is told incorrectly that their vision is perfect because they read the small letters at a distance. Identifying small letters at distance, like on the Snellen eye chart, one eye at a time, doesn't tell us how somebody's using their two eyes together as a team or tracking across a page. And that leads the child to feel inadequate because their assumption is, if it isn't my eyes, it must be that maybe I'm just not as smart as the other kids in my class. A child's vision can affect every part of their life, both inside and outside the classroom. Many children don't realize that the source of their reading problem is a vision issue, and even parents and teachers aren't often aware. Children assume that they see the same way that everyone else does. And that's why a pediatric eye examination by a developmental optometrist is so important for your child's school success. Our office is geared for children, and we know what tests need to be done. We even see infants and toddlers. We test children's eyesight, eye health, and visual skills like eye teaming and tracking. We're able to do an examination even if a child doesn't know their letters. We can do tests and figure out what a child is seeing even if they can't tell us what they're seeing, in the same way that a pediatrician figures out why a child is crying. But we can't do it alone. We need your help so that we can help your child get the care that they need so that they can succeed. When should you take your child for an eye examination? Well, the first eye examination should be when a child is about 6 months old. That may seem young to some people, but it's critically important in order to identify problems as early as possible. Their next visit should be at about age 2 to 3, and again before entering first grade. A child should have an eye exam by a developmental optometrist every year that they're in school. Help us to help you and your child succeed in school. Call our office to schedule your child's appointment. 732-679-2020. I'm Dr. Moshe Roth. I practice in Old Bridge. The name of our practice is Family Eye Care.